So NELFT was the very first NHS organisation that I worked for since coming over from South Africa. My first role was in the private sector for 6 months, but I wanted to develop my career and therefore looked at an opportunity in the NHS. And NELFT was the closest organisation to where I were residing at that stage.
From the very beginning, I've seen an openness, and communication has been really good, which was very encouraging, because my previous experiences were less encouraging. The difference was being listened to, taken in consideration. I was heard when I had an opinion. I was even asked, regardless of the professionals I was working with. So I'm talking from, let's say, the more junior members of the team to the higher management level. I felt valued and appreciated.
The opportunities to train and develop were quite obvious to me, career development, leadership, of which I've been part of in the last 5 years here.
What attracted me to NELFT? First of all, the organization itself, because I had an opportunity to see how the system works in NELFT as a specialty doctor and higher specialist trainee, and the way the care was provided to patients who are in need, and also the structure and the resources within NELFT, which attracted me.
Obviously, being a doctor, I want to ensure that the best quality of care is being provided for our patients. And there's always a keen interest to develop or to understand how we can improve that. So it's not a static process. It's very dynamic and very open for suggestions.
I think there's a good deal of cooperation across disciplines. We look after the most unwell patients in the acute and rehab directorate, and you need a very clear MDT-based working, and that's a good thing I can point to. The work is intense, but it's rewarding to see people get better with time, with excellent, good quality, multidisciplinary teamwork. And the leadership are hands-on and supportive in that.
We are a 24/7 service, the home treatment team, and when patient is under our care, we tend to start the visit the first visit can happen within first 4 to 6 hours of admission to the home treatment team. And whilst they are under our care, the patients can contact home treatment team at any point, 24/7, 365 days a year, which all our patients appreciate, including the carers and family members.
So we have very good buy-in from our patients in helping us co-design and co-produce our services to make it streamlined to the needs of patients.
Thinking about staff support within NELFT generally, I can say that a good investment has been made into the well-being of staff. I've had access to offers to gym membership, yoga, mindfulness meditation support, and the WellNEL team have been fantastic, particularly around the pandemic. There was offer with all sorts of support, individual and collective group supports.
And we have daily handover meetings where if someone needs support, they can always discuss. We do have monthly team business meetings where there's a whole afternoon is dedicated to discuss team issues, and the manager who chairs the meeting is ready to support the staff members.
In terms of staff support, I think the organisation are front runners in terms of working with a diverse staff group. We have a big emphasis on ethnic minority groups and supporting other minority groups within the organization.
As an international medical graduate, working in NELFT helped me in integrating with the UK culture and the work ethics very well.
There has been an active focus to make sure that the staff are well. I mean, even within our team, I know from my personal experience that is something we manage and focus and improve as well, alongside with the quality of care that we provide and the patient-centered intervention. So definitely there is a myriad of options, of projects that are running in terms of supporting staff.
Since joining NELFT, I have remained with NELFT. I've completed my junior and senior training in NELFT. I took on a consultant role in NELFT, and I also then developed my leadership in NELFT. I was the Associate Medical Director for the Acute Directorate, and I also then become the Medical Director for the Trust.
What makes us stand out is that you have that robust collective working within the system, and we have very good models that are constantly evolving to meet the needs of the population. For example, we've just had the clinical decision unit set up to help with triaging those who come through the doors. And I think that has gone a long way to help. We have the home treatment teams as well to get people back on their feet and in their homes and provide ongoing care. So I think the Directorate has been so set up to be efficient.
Acute and Rehabilitation Directorate, compared to other directorates, is as we deal with patients who are going through crisis, who needs intense crisis input. It's a fast-paced with the quick turnover and dynamic teams across all parts of ARD. And what we do differently is we communicate with other team members quite closely.
What makes the ARD Directorate unique as to the other directorates in the organization is that it covers 4 different boroughs of the outer London area. So it's not just borough-based. It also mainly deals with patients who are in mental health crisis and needs urgent mental health input. And the way that we deliver that is in the least restrictive model.
I can see the cohesion and the collaboration between professionals within the adult services and how well they work together with our services, the children's services within ARD. And that's definitely driven by the management nature, really.
I've had the opportunity to develop in leadership. I've just concluded my time as the Associate Medical Director here, and now I'm the Clinical Director for the Forensic Services. That's a testament to the fact that the Trust is open to diversity, but also open to being very inclusive. If you're good and you've got something to offer, we would definitely want to have you here in NELFT.